Hello, everyone, and welcome. My name is Chelsea Hagopian, representing the board of the Emory Nurses Alumni Association, to introduce and connect you with the unique nursing roles, experiences, and insights of fellow Emory nursing alums, faculty, and students. Today, I'm incredibly excited to be joined by Dr. Corrine Abraham, a fellow Emory nursing alum and board member of the Emory Nurses Alumni Association. So thank you so much for being here, Dr. Abraham.
Sure, thanks, Chelsea. Yeah, I'm a really proud member of the Alumni Association along with you, so I'm glad to join you. Long time ago, 1985, I graduated with my own graduate degree.
So could you share with us a little bit about your current nursing role?
Sure. So I am blessed to have a joint role. So I have a job at the Atlanta VA healthcare system where I'm the coordinator for evidence-based practice and innovation. And what that means is I help establish the infrastructure, but also work closely with nurse leaders. But more, I guess what brings me the most joy is working with staff nurses or those who are providing the care in being innovative or applying evidence-based practice. And then I'm a faculty person at the School of Nursing at Emory, where I teach in the DNP program. So I think both my teaching at Emory informs what I do at the VA, and what I learn through the real world and lived experience informs my teaching. And also, I do want to point out that I'm co-director of the VA Quality Scholars Postdoc, which is an interprofessional postdoctorate training experience where I think that's probably the most important, or I guess the most robust way for me to practice my craft, so to speak, because it's at that level of scholars learning implementation science. And it's a little beyond what I would do, let's say, in evidence-based practice with the staff.
So to start, I'd really like for you to share what interested you in nursing, how you started your nursing career, and then kind of walk us through the different roles that and experiences you've had that really have shaped the nurse that you've become today.
Okay, well, going back into the dark ages. So I've been a nurse a long time, and back in the day, it was a big deal to be a bachelor's prepared nurse. So I graduated, and my first job, well, and what really led me to be a nurse was I always, it was between being a teacher or a nurse. I was just a helper by nature. I think part of it was being firstborn. So my first job was pretty formative for me because it was in a community hospital, and it was in a hospital where they had their own diploma program, and I was viewed as some young whippersnapper that came with a nursing degree from the University of Iowa. And so I didn't feel especially welcomed because I couldn't run circles around them, I guess, clinically. So I didn't last long there because I just felt it wasn't a good fit for me. And I think it's important as you go into your career to recognize what's really going to support you and nurture you in your professional development. So I went from there to another academic hospital. I went to work at Loyola in Chicago. And that was an academic setting, which is what I was used to. And I thrived. I was able to, I worked with nurses who I really looked up to that were still young, and I could see their practice, and I could see how they worked as an interprofessional team. I mean, we hear so much about that now, but again, back in the day, we didn't have electronic medical records. And so we actually sat at the station, a large station, not little cubicles, and talked and discussed patient care. So again, that's where, and then I, was looking up to advanced practice nurses. I remember a CNS in particular who took me under her wing, and I worked together with her creating patient education courses with post-op patients in cardiac. So again, my teaching came out, and it was where I developed my skill in precepting nursing students. Because it was an academic center, I had an opportunity to work with. And as I matured in my role, I was kind of that go-to person when I still remember somebody had a difficult IV stick and they said, oh, you're the let's come, you can do it. And I flubbed it immediately. So just because you had more experience doesn't mean you're not going to make mistakes. So anyway, so that kind of helped me differentiate the type of setting that was important. And there is a difference. In moving to Georgia, I worked again at another community hospital. Again, that was not the best decision, and it re-emphasized maybe the importance for me to be in an academic center where there's maybe more professional development opportunities. And really that prompted me to go back to school at Emory when I moved to Georgia. The dissatisfaction with where my professional career was going prompted me, and I found my home at Emory. Went to school and got my graduate degree, the faculty, and just the environment. And so even after graduation, I always thought I was going to be a clinical nurse specialist. Again, going back to my early mentors, like I want to be her. Like I found that nurse, like that's who I want to be. And just the way things unfolded and opportunities present themselves that I wasn't looking for, but there was an opportunity to teach clinically after I graduated. And so I did dip my toe in and found that it was something that really met my need. I could, teaching clinically, I was able to engage in patient care, which is really my love, being at the point of care, but also be a teacher. So that's where I pretty much stayed in that role throughout the rest of my career. It really set the stage for me.
So I hear as you're talking about your nursing journey, how you started out by really role modeling. You had a nurse that you wanted to be like that nurse. And then throughout your career, you really found where your passion was and you followed that. So it started with that modeling of someone that you looked up to, and then really finding your fit.
That's true. And, I think I mentioned where maybe there wasn't a good fit for me, but even so, when I reflect on those experiences, what made them meaningful, and when I think back, were the people that I could look up to. So interestingly enough, my first job, it was that nursing assistant who took me under her wing and who was so excellent working with patients and I guess non-judgmental towards me. And then when I moved to Georgia, there was a clinical nurse specialist who was very inquisitive and had a great relationship with the community physicians. And so seeing that really, and I was in a new type of practice setting. So again, even though it wasn't a good fit, perhaps in the big picture, I was able to find somebody who really I felt supported by and who really had that expertise that I wanted to model. And she was very involved, or a couple of them were very involved in the professional organization. It was a critical care setting and it was new to me. So I was able to find support that way. So I do think regardless of setting, there are always those hidden gems that can help you in your career.
Certainly. And then I hear you talk about how at each stage, when you experience and you have a new opportunity, it's a little bit of that role transition. Even as a seasoned nurse, you're still looking for new opportunities to learn and new mentors to help guide you in the direction that you're looking for. I know that I remember fond memories of being one of your students and learning about quality and safety and evidence-based practice. And now as a very novice faculty person, I reflect and am attempting to model the behaviors that I see in you as I learn how to now teach evidence-based practice. So it comes full circle.
I mean, it really does. And I think to appreciate and to recognize that it doesn't matter where you are in your, I guess, career trajectory, I think change is good. And to recognize I had to give myself permission to feel like a novice again. When I tipped I got my DNP late in my career. I didn't really mention my educational, once I got my graduate degree at Emory, I was much later in my career deciding to go back and get my DNP. I wasn't young like you, Chelsea. And so being a mature learner, feeling like a novice again, and putting yourself to feel, I would say, vulnerable again, and was it was unsettling in a way, but it's always, with that comes growth. And then that like ignites more excitement, so stagnation is not always the best thing. So I guess pushing yourself to be a little bit uncomfortable and give yourself permission to be a novice again. And it kind of leads to that long career where you could always feel energized, in my opinion.
I think that that is such useful advice for everyone that's listening. I know that it is very useful for me as I am presently in that feeling like a novice phase and learning how to teach and recognizing that it's okay to not feel like an expert anymore and just really embrace the new experience and continuously to reach out to mentors such as yourself who I like to model your behaviors. So you have served as a wonderful mentor to myself and others. Is there anything that you'd like to share with us about your experiences with mentorship from the perspective of being a mentor?
Sure. So I think, there's different situations where you find yourself as a mentor, and sometimes it's formal and sometimes it's less formal and structured. I think there's benefits to both. But in the true sense of the word, if you're, looking for I guess, a successful mentoring experience that's successful for both the mentee and the mentor, if there is some structure around it, and the biggest reason is so that there are clear expectations, and so that and that helps facilitate communication. So in the fellowship that I talked about, we have a very structured mentorship, I guess, framework, and where we have set meetings. And even if we don't, and the meetings should have set agendas where we feel like we're productive and that we're meeting the needs. And sometimes it's just a matter of having that accountability partner, that person to support you, and to maybe provide resources. And then also, as a mentor, what I learn from my mentees all the time. So there is a give and take, like, what do I want to get out of this? Sometimes, in partnering with somebody as a mentor, you recognize that you don't have all the answers, like you just said. So it's not that you as the mentor are expected to be the be all end all, but that you recognize, you help the mentee articulate their needs, explore their needs maybe, and then help direct. It's like, what, I'm not exactly sure about that, but I think this person might be good. So even expanding, kind of like that network, right? Like, this is who you need to talk to. This person has done something like that before. So and then, I think having that the confines of when is it going to end. So I did sign up for Emory through Emory Connects in their formal program. And, it was a short-lived program. They were very like, here's when it begins and here's when it ends. And here's some, you should probably try to meet this many times. So there was structure, but it left you at the end to be able to, I say negotiate, but to say, I've really enjoyed, getting to know you. And if you ever have any questions, let's get together or touch in periodically. And especially with what's going on right now, I mean, even without that set meeting, I've reached out to my mentee who I connected with and said, how's everything going? Are you managing okay in this, when we were surging with COVID? Is everything going okay for you? So, so it's a kind of a sounding board. So
and I see that it's nurturing really that relationship and fostering connection as well as learning and growing together.
Mm-hmm. Yeah.
Well, that's wonderful. Well, thank you
Yeah.
so much. I really appreciate you sharing your roles and your experiences and your insights with us today. And is there anything else that you would like to share with students, alums, faculty, anyone who is listening today?
I would just say, I think just asking the question, I think sometimes being not expecting or looking for that person, it may not even be in your specialty, but just getting to know somebody. It's interesting how you find common ground without knowing, oh, well, I work at the VA and I work with adults, but that doesn't mean I may not have something to add to somebody who's with the pediatric, so open your horizons around who you reach out to or think about as a potential mentor. And I think in nursing, thinking beyond our silos, it doesn't need to be a nurse. I mean, if you're really thinking about somebody who is in a totally different field. So I think that's one of the values with the Emory Connects opportunity is, let's get out of our silos. It's really important to think interdisciplinary and to think about what we can take away and learn from other disciplines that really enrich our own understanding, maybe of ourselves. And so look beyond. It's great to look within nursing, but think about just life coaches, just how to deal with life, how to negotiate, how to advocate for yourself, how to
Absolutely.
take, yeah.
And then as far as that mutual relationship, it then brings the unique contribution and nursing perspective to outside of the nursing discipline, because the nursing perspective is relevant everywhere.
Yeah, and I think we tend to get cloistered and siloed. So that would be break down those walls.
Thank you so much. I really appreciate it.
Oh, you're welcome. Thanks for having me.